Who would not be a good candidate for a facelift? The first answer would be somebody that's possibly younger, that's not going to see a lot of change, but maybe has some unrealistic expectations. First of all, we have to balance the trade-offs of doing the surgery with the amount of change and try to get a feel for what the person's expecting in return for that trade-off. And if it's going to be a fairly minimal change, it's important for them to understand what's going to occur, and the possibility that a scar that normally would blend in could be a little bit more visible in a younger person with smoother skin. So that would be the first type of patient that it wouldn't be necessarily a good candidate. The second type would be maybe somebody that's had a previous surgery in the facial area, let's say a tumor in the parotid gland. The parotid gland sits on the over the jaw, angle of the jaw here, and the facial nerve that supplies all the muscles to the face comes out of the foramen behind the ear, deep to the earlobe, and it spans across the face in branches into 5 branches right through that gland. And so if somebody's had a surgery already, typically they've dissected those nerves out, and they've dissected the lateral part of the gland away, sometimes even deeper if it's in the deeper lobe. And so those nerves are exposed, and the skin is placed back down over it. And so the skin is really kind of trapped into the nerves rather are kind of trapped in that scar tissue. So going back and doing a facelift would be a fairly risky endeavor to do. So that would be another person that I would think should really consider the risks, or the surgeon definitely would consider the risks and decide whether or not that's a wise decision to attempt a facelift on somebody like that. The third category of people that are not good candidates for facelifts are people that have health conditions that would put them at risk. Either if they're going to have general anesthesia, for example, and the risk of having general anesthesia with some of their conditions, say their heart or their breathing issues, would put them at a significant risk. That could be a problem. Or if somebody has a condition that they're at a higher risk for developing an infection because they're immune compromised, and maybe somebody that's had an organ transplant and they're on medications that are affecting the immune system, probably not the greatest candidate for a facelift surgery. And I probably would not advise them to do it, because the risk of them losing an organ that's been transplanted would not be worth taking. Also, certain conditions that affect the healing of the skin, that could range from somebody that has diabetes that's not under good control, that can affect wound healing and put them at greater risk for an infection even. So we want to make sure that people are in reasonable health for these kind of procedures, and that they will heal up well from it. Obviously, people have to have controlled blood pressure, their heart has to be in good shape. So if there's any question about those kind of things when we check blood pressure and so forth, we will address that in terms of trying to get better control. If they've had heart issues in the past, we'll usually consult with their cardiologist, make sure that they're deemed to be safe to have anesthesia. Now, one of the things that's nice about having the option of doing local anesthesia for a number of these procedures is that does seem to be safer for some patients that have health conditions. And as long as we can keep them comfortable through the procedure, that they don't have other exclusions to doing a local procedure, that can be a really great alternative for people that want to have surgery that maybe have some other health issues, because we're not anesthetizing their other organ systems like you would if you're giving gas anesthesia, and there's lower risk for those other medical conditions sometimes. I hope you've enjoyed this video. If you have any more questions or you want to make an appointment for a consultation, please feel free to contact us at newportfaces.com. Call us or text us at 949-566-1032.